Seattle Indian Health Board rose from the social justice movements of the late 1960s and early 70s.
It was started by a group of these dedicated, passionate volunteers.
We did not have computers then, and you could count the number of doctors on one hand.
The work that Seattle Indian Health Board was doing was just awe-inspiring. Clinics throughout the country have benefited from the work that's being done here. It was a time of assimilation. The Relocation Act really encouraged Native people to move out of reservations and into urban areas.
They gave everybody a one-way bus ticket and said, if you want better access to economic opportunities, you want to become a doctor or a lawyer, we will give you a one-way bus ticket from your reservation into 12 relocation sites. When Native people arrived, they were not met with those promises.
A lot of Natives in Seattle were finding that the jobs that were promised weren't here. Education wasn't a possibility for a lot of people.
The benefits we were promised as American Indian and Alaska Native people were being limited by the federal government to only tribal lands.
We lost a lot. Access to our land, we lost a lot of our relatives. This was really a form of cultural genocide.
But we did what we do best. We came together, all different tribes, and said, just because we live in cities doesn't mean that our benefits disappear.
The government owed something to us. Nobody else is gonna give us the things that we need. We really have to provide that for ourselves. And those agreements listed healthcare.
One of the most beautiful things about the story of the Seattle Indian Health Board is how Indigenous women came together to say our people deserve more.
Bernie White Bear partnered with the American Indian Women's Service League to start to form free clinics.
They literally moved a file cabinet out of a file room and started providing services to our people.
When they got their 501c3 and became the Seattle Indian Health Board, Bernie White Bear was the first person hired as the executive director.
Since that time, we have grown from moving that file cabinet over to now we're a $32 million organization.
What is the next 10 years going to look like? What's the next 20 years going to look like? That is our responsibility to continue what they started, to ensure that we are not only here 50 years from now, but 5,000 years from now. That is the blessing that we have here at SIHB.